Hi everybody, and welcome once again to the AARC Big Ideas Theater. I'm your host Ed Highland, and I'm joined now by Dr. Milan Hahn, who is talking about the challenges of COPD. Thank you so much for joining us.
Thank you, it's great to be here.
Give us some thoughts, if you will, about some of the biggest challenges for patients with COPD.
We have a lot of work to do. I think I spent the last few years interviewing patients, talking to care providers at all levels, and I think the biggest problems center around access. Patients have problems with accessing affordable medications. They have problems accessing specialists. We don't have enough pulmonary rehabilitation programs, particularly in rural areas. So we have some really very basic needs for our COPD patients that we have to figure out how to meet.
One of our guests earlier was talking about how many undiagnosed COPD cases there are out there, almost as many as are currently diagnosed. I mean, it's kind of scary in that respect.
Yes, it really is. We have about 15 million probably undiagnosed individuals with COPD in the U.S. I actually was just rounding in the hospital yesterday, saw a patient that had come in for surgery, was doing poorly. Turns out he has end-stage COPD. It was undiagnosed before the surgery.
Well, in some ways, lucky for him then that you were able to find that.
But we're now trying to deal with the complications.
Exactly.
Because it was untreated, unmanaged prior to the surgery.
Well, and then that fits into the next question about some of the biggest challenges for providers for patients with COPD. First, it's finding it.
Right, absolutely finding it. So the U.S. Preventive Services Task Force recommends against population-based screening, not necessarily because it doesn't help, it's just they don't have any evidence that it helps. And so I think most of us think, well, we need to be smart. We need to find patients that are either symptomatic or at risk for having bad outcomes. But how, as opposed to just screening everybody, how do we find the patients who really need to have testing? And so that's really the challenge. I've been working with a group with the COPD Foundation, also National Institutes of Health, to create some case finding tools that physicians can use, but we're just working on validating those. So trying to get those kinds of tools into the hands of primary care physicians and getting them to use it is really the challenge right now.
On the line of those tools, what are some of the innovative approaches for treating the patients?
So for diagnosis, I've been working on this capture screening tool, but from a therapy standpoint, their new medications hopefully are going to be coming down the pike. But I think we also need to think about other ways of delivering care. We've got lots of patients in remote areas. We've got all the specialists in urban areas. So we have to start thinking about things like remote, telehealth, electronic resources, online support forums for patients, kind of, utilizing the newer technologies to try to deliver care to patients.
And that unfortunately plays into which we don't have time to discuss, of course, but the whole national healthcare system and what's happening there and those challenges of getting the dollars to the people who do not have them right now.
Yeah. The current healthcare system, I think, poses some really unique challenges to patients with COPD because of the unique way in which inhalers are used. And so it's very difficult to just switch them on the fly because patients need very specific training on them. And so that's unfortunately one of the things that happens today in healthcare, is that those kinds of things get changed all the time. So I think unfortunately COPD patients, perhaps more than any other group, gets caught in the middle of the huge kind of Medicare morass. And it can be really difficult for them to navigate, and also difficult for us providers to help them navigate the system.
Well, we certainly hope some answers are found, at least we head in the right direction in the near future. Dr. Milan Hahn, thank you so much for joining us.
Thank you.
And this is the Big Ideas Theater at AARC. It's sponsored by Draeger.